Welcome to Holistic Health for Happy Kids, the podcast where we dive into the root causes of children's health challenges and explore natural solutions to help little ones thrive. I'm Lisa, a passionate paediatric naturopath and mum of 3, dedicated to empowering parents with practical tips and expert insights to raise healthy, happy kids. Each episode will unpack common childhood health concerns like allergies, eczema, fussy eating, and gut health, and share evidence-based advice to support your child's wellness naturally. Let's create a generation of thriving children, one holistic step at a time. Thank you for joining me on this journey.
So welcome to another episode of Holistic Health for Happy Kids. And today I'm joined by Natalie. So Natalie is one of the naturopaths on our team, but she is also an myofunctional therapist and also an oral health therapist. So anything mouth related, Natalie is your one. So Natalie, thank you very much for joining me today. So you have a very unique clinical skill set. You're a naturopath, oral health therapist, and OMT. How does that change the way that you assess the kids that you see in clinic?
It's a very unique skill set. And I think kind of all the practitioners that you'll see in this space, whether it's an ENT looking at airways or an airway dentist looking at the mouth and the airways, or even if you're seeing a naturopath, who I love that we have kind of a very holistic lens on things. Naturopaths don't really care about the mouth as much. We do, but it's not our focus. So having that training in oral health therapy and now in oral myofunctional therapy, it's made me really try and fit all the puzzle pieces together, not just for the parent, but particularly for the child. So I guess no single referral pathway is looking at all of these things, which is great and allows me to really dig deep to look at kind of the root cause of, what's driving this picture in kids.
Yeah.
So if anyone has this dual training, please contact me. I'd love to meet you and I'd love to actually connect with you. And it would be great. I don't know if anyone else exists at the moment.
Yeah. And I should say the reason I know Natalie is because Natalie was my daughter's dentist, oral health therapist for many years. And then one day I turned up for her appointment and Natalie was gone to become a naturopath. And then, of course, many years later, Natalie's now working for me. So I know what a wonderful clinician she is. So you do a lot of work with tonsils and adenoids. What made you realize that tonsils and adenoids were such an important part of the picture for kids' health?
And to be honest, my own child. And I think as naturopaths, we always seem to specialize, particularly in pediatrics, in the areas that we are living in the trenches ourselves. So my son had a lot of feeding difficulties at birth, high narrow palate, terrible sleeper, which made me really investigate this space and look at it from really all angles, not just, from the sleep perspective, but from, the growth of the jaws, the mouth, the palate, and how all this plays a part. And what it made me realize that tonsils and adenoids play a big role in children that have narrow airways to begin with. So like the son, if we can think of their airway like a room, and maybe the tonsils and the adenoids are a chair and a table in that room, we can imagine for certain kids with a narrow room and a small room, enlarged tonsils and adenoids are really going to cause a lot of issues and block the airway. That same tonsil size and adenoid size could be enlarged in another child that has a nice wide palate, nice wide airway, and it's not going to affect them as much. So that's why looking at the whole picture is really important, because we're not only assessing, how enlarged maybe these structures are and how it could block airway space, but also, how it plays a role in their growth and development.
Yeah. Well. So if we can make a bigger room, the big chairs aren't going to be so much of a problem.
That's what we're hoping.
Yeah.
It's not always the case. It's possible when we think of younger children, but that's the aim. Ultimately, we want a bigger room.
Yeah.
And that's the end goal.
And is that why you know, adenoids are a problem in children up until about age of 10, but then they're not so much of a problem. Is that just because the root gets bigger?
And the adenoids shrink. So we know that they start to shrink as well from the age of 8. So a lot of factors are playing a part. The room gets bigger as they're growing, and then adenoids naturally will start to shrink. Not in everyone, but usually we see it from 8.
Which is always interesting though, when you see someone who's had their adenoids out when they're like 9, which is quite late, think, possibly if you just waited a year, then the problem would have gone away itself.
Possibly, but we'll discuss all that today, won't we?
So often, people hope that their children will just grow out of these issues with airway and tonsils and adenoids. What happens, when it's not treated and we just watch and wait?
Yeah, so this is important on what we were discussing about that 8-year-old that may have had their adenoids out. The research on obstructive sleep disorder breathing and obstructive sleep apnea in children is really sobering. And I think every parent really needs to know, what this research is all about. So there's documented impacts on things like IQ, attention, emotional regulation, growth, which is a huge one, even things like cardiovascular health. So when we see kids that have obstructive sleep apnea, which is the most severe form of sleep disordered breathing, we know that it's hugely affecting their development from their IQ. So there's a study that shows like a 5-point IQ drop, excessive daytime sleepiness, which obviously affects things like concentration and then their emotional, ability to get through the day, decreased attention, all these ADHD signs in kids, which it could actually be a sleep breathing problem. So these aren't kind of minor things that, we can have like this watch and wait. Let's hope, all this improves. There's massive developmental consequences, particularly in the first 5 years of life. That's when the most growth is happening in their little bodies, particularly in the jaws and the head and neck. They're the kind of golden years. And that's something we really need to have an alarm on. Kids is snoring and showing signs of this sleep disorder breathing.
Yeah. And so snoring is kind of a bit of an obvious one, but not all children will snore, even with a sleep disorder breathing. So what are the other more subtle signs?
One of the common ones that I see is their mouth open during sleep. So that's an airway compensation. The airway is opening up in order to get more oxygen, and mouth's opening up. And it might not even be during the day. It might just happen at nighttime, which gives us some signs of, what might be kind of causing or behind some of these symptoms. Another one is really restless sleep. They could be sweating in bed or very active, moving from their side to the back, or even horizontal sleeping where they're moving kind of 360 around the bed. Another big one is teeth grinding. There's a few reasons for teeth grinding, but one of them is obstructive sleep apnea, when the lower jaw is literally moving forward to try and open up some airway space. So the teeth are meeting edge to edge, and particularly in kids that have more of a class 2 malocclusion, where their lower jaw sits back, they're actually bringing their teeth forward to help open airway space at the back of their mouth. Snoring, obviously, as we discussed, even if it's occasional, that's a compensatory sign. And then the daytime signs of the hyperactivity, that emotional instability, irritability, lack of concentration, and also some other nighttime signs like bedwetting, and that's beyond the expected developmental age. But it could even show up as things like very slow eating and food refusal. Like it can show up during the day, these nighttime signs as, picky eating.
Yeah.
There's so many interrelated things that can happen when we're just not getting a good and restful night's sleep.
It's funny, it just reminded me of a client I spoke to this morning, and the daughter is 8 and she's cracked 2 teeth. And I thought, that's very unusual, but I guess that could come from really intense teeth grinding, could it?
Absolutely. And a lot of parents are unaware that it's happening, particularly if it's happening just at night time. They're not grinding during the day, unless you're in the room with them or you go in regularly to check. This is a sign that a lot of parents miss. That's one thing I would recommend all parents do tonight. Go into your kids' room at different points in the night, maybe just after they've fallen asleep, maybe just before you go to bed, and just listen to their breathing, listen to any sounds, watch if they're restless, and also feel them if they're sweaty or hot.
Of course, like nowadays we can just video that as well, so we can kind of compare night to night. It's kind of the teeth grinding, so like the fingernails and the chalkboards are really horrible, really horrible sound. And can children have big tonsils but not have tonsillitis?
Absolutely. And so in terms of kind of the criteria now for surgery for getting the tonsils out has really changed, and ENTs are moving away from, removing tonsils due to tonsillitis, unless it's very severe. The reason tonsils and adenoids are removed now is due to obstructive sleep apnea. And so as we think about our room, particularly in kids with that really small room, when the tonsils and adenoids are very enlarged, particularly in younger kids, you can just imagine how much space it's taking up in that room. And so when we're not addressing the root cause, we're not figuring out why these tonsils are enlarged, why these adenoids are enlarged, in order from a developmental perspective, in order to get them, sleeping well at that age, particularly young children, we're left with no other option. And so particularly when tonsils are grade 3 or 4, so you're significantly taking up space in that room, it's going to affect their sleep, development, as we mentioned before, affect kind of all facets of their life.
Yeah. And so, how does the enlarged tonsil adenoids actually change the way a child breathes and chews? What about their tongue? How's it all related?
Well, if you can think about a blockage at the back of your throat, it's really going to affect things like swallowing and your desire for food, particularly if they're significantly enlarged. Or when we think of adenoids, them being enlarged, it's going to affect our taste perception. It's going to affect the way we speak. It's going to interrupt kind of all that room in the nasal passageways that we use for speaking and eating and communicating and talking. And then also it affects tongue posture. So when our tonsils and adenoids are enlarged, our mouth naturally opens up in order to get more oxygen, and our tongue then is going to rest low in the mouth. So when our tongue's never suctioned up on the top of our mouth, that's when we get issues linked to kind of atypical swallowing patterns. We also get weak tongue muscles because they're just not getting that workout that they would usually get. And the tongue's really important, particularly for palatal growth and development. It acts as this natural jaw expander when it's sitting nicely on the roof of our mouth, and it's this growth stimulus. It's telling the palate grow wider. And so when it's not sitting there, you can imagine how much it affects the way our, the jaw structures form, the way our face grows. We get these very long and narrow face shapes in kids with enlarged adenoids because they're not, breathing through their nose, and their tongues are suctioned up the roof of their mouth.
It's only in the last year or so that I realized your tongue is meant to sit in the roof of your mouth.
Yep.
Every time I have this conversation with somebody, I'm always like fiddling around with the roof of my mouth. Where's my tongue? Where's my tongue? It's quite funny. And so when do the problems start with all of this functional development in your mouth and your nasal passages and everything?
Well, to be honest, it starts before birth, so nothing that we can necessarily challenge, really. So, the palate doesn't just form, when we are born. It starts really early on. So the actual structure begins taking shape from 5 to 6 weeks into pregnancy, which is amazing. And by kind of 12 weeks, the palate is kind of structurally complete. So by the end of the first trimester. But, this process, even then, is dependent on the tongue being in the right position, which is unbelievable. It plays such an important role, the tongue, from the start. So from birth, obviously, that's when often kids will get a check in their mouth. They'll, check for things such as really restrictive tongue tie, what we call ankyglossia or tongue tie. And that's usually, checked out at birth and often released if it's causing issues with feeding. But that's one reason why, the tongue and the palate can grow normally if there is this tethered tissue, because it's so important for our tongue to rest on our palate. And there's a few reasons, obviously, this happens, as we're talking about, happens in development. And then with a tethered tissue, if it's not addressed at the time, or, there's prolonged bottle feeding, dummy feeding. These are all a compensatory thing that instead of the tongue, the dummy is in the palate. And so that obviously affects growth and development as well.
So what, we obviously, we love to see moms at the preconception stage because, if we can get all these things right, obviously nobody knows they're pregnant when they're 5, 6, 7 weeks pregnant. So what can we do before we even get pregnant then to help with this?
Well, in terms of the genetic component, unfortunately, it's too late.
Yeah.
A great tip for anyone who is not married and not pregnant is find someone who has a completely different jaw shape and structure than you. Find someone with a beautifully wide palate.
Yeah.
Beautifully.
So
jaw.
when you're on your dating app, we want somebody with a square jaw. That's how to afford it. Yeah.
And attraction theory is really interesting. So naturally, we are, biologically wired to be attracted to someone with a very different face shape to us.
Wow, I did not know that.
So we are attracted to, the tall and skinny man if we're the opposite shape. And it's truly for the reason of procreation. So we are more balanced, our genes are more balanced, which is so funny how it works out. So there's not much we can do from that genetic component. And we know that there is links between, a family history of sleep disordered breathing and sleep apnea, and obviously the risk for our children to, have the smaller palates and the smaller airway space. So there's that genetic component. So there are some things we can't change and do, but there's absolutely reason for, making sure our maternal stores of our nutrients and our minerals are replete before having kids. Spacing out our children is great. Making sure, we have adequate levels of, all the most important nutrients, iron, vitamin D for growth and development, folate, B12. And so the preconception program is such a great place to start in order to do so.
Yeah. Yep. So we have a membership that starts at preconception, goes all the way to 2 years. That this is where we can help, especially if you're on sort of, baby number 2 or baby number 3, you've had these issues already, then it's good to jump into that. So even though you are an OMT, I always still struggle with trying to remember what the OMT stands for. So it's orofacial myofunctional therapy. So if there's parents out there who haven't heard of it, or just people like me who can't remember what it stands for, just tell me a little bit about OMT, what that means, what you do, what your training is and that.
Absolutely. So the aim really is to retrain or re-educate the muscles of the face, the tongue, and the lips and throat. We really want to restore correct tongue function, so correct tongue rest posture, nasal breathing, lip seal, swallowing patterns. So this is all about the muscles in the face and the jaw and the airways. And I guess the goal is to create this environment where normal development can just take place, where we're kind of removing any hindrances to that, and we're allowing, I guess, structure will always dictate function. So we're aiming to really restore that normal function in kiddies.
And so what do you do? Like in an assessment, an initial OMT assessment, what do you do?
We're looking at everything from sleep. We're looking at, the actual, symmetry. We're looking at the tongue posture, tongue rest, tongue movement, tongue mobility, if lip seal is present or if the lips are open. We're looking at, dental kind of arch. We're looking at the teeth, how they're moving together. And then also, other things like, how kids breathing, and how is their posture, is their head forward, is there these compensatory patterns going on? And so it is obviously very specific to the head and neck, but we're looking at everything from sleep as well to their daytime behavior and allergies and nasal congestion and what's happening at nighttime.
Yeah. I'll never forget going to a conference and so there's an ENT speaking at the conference and somebody said, what can we do about allergies? And the ENT said, well, luckily we can't do anything, which is good for me or I go on a business. And so he was clearly saying that if we could actually address allergies, then nobody would not nobody, but his business would be seriously reduced or removing tonsils and adenoid, which is great then, because that's where you come in, because you look at the whole picture. You look at the function, but you also look at the allergies, the gut health, all the things that contribute. We're not, so simple. So, obviously some children will absolutely need their tonsils and adenoids out without a question. So that is I feel that that's a difficult judgment to make.
Yes.
And so how do you kind of make that call, whether you think you can help them with, conservative management, looking at gut health, looking at allergies, and when actually they just need to go to an ENT and get the surgery done?
Well, if there's any signs that the airway is compromised at all, or any signs of, obstructive sleep apnea, I'm recommending them to see an ENT from the start. But I think because the structure is really important. We're thinking about that small room. A lot of kids that come and see me have a very small room. They've got narrow palates. So seeing an ENT, doing a sleep study, assessing, what level of obstructive sleep apnea is present, if it is present, is really important. Gives the parents all the info that they need to then make a call, make a decision. And then obviously, once the ENT assesses things at the same time, because there's often quite a long wait, we are addressing things like allergies. We're digging deeper and figuring out what actually is the root cause behind these enlarged structures. Is it allergies? And if so, can we change the environment, or can we address food allergies? Or could it be as simple, and it often is, it's like an immune system issue where often they're low in iron, low in vitamin D, low in these really key immune nutrients that help our body respond appropriately to the environment that we're in. So that's what I love to do first. Checking the really simple things, checking, with some blood testing is really important. Nutrients, looking at allergies, addressing that, and then just supporting the child. Whether or not we see resolution of these tissues and the size is irrelevant, because we're addressing the root cause.
Yeah. So your child will be better off, regardless
100%.
of whether they need surgery or not. The child will be better off, like in other ways.
Yeah, that's the key. And, we often see kids who have, 2, even 3 surgeries for their adenoids, for example, because the root cause was never addressed. The allergies weren't fully assessed and addressed at the time. And unfortunately, and we see quite commonly, the adenoids are regrowing again.
Yeah. So if your adenoids regrow, you have an allergy of some sort, basically, don't you? Yeah. So you need to find that out. And that's exactly what I think as well. Like, go on the waiting list for the ENT, but in the meantime, do all this work. And then who knows if you can cancel the surgery closer to the day. That's great. I also think some ENTs are very, very good at assessing a child. Whereas I do feel that some ENTs, when you go for the appointment, you're just signing up for surgery without any other kind of avenues being explored.
Yep.
So I think it's worthwhile looking in your local area for who the people are who will actually evaluate the child, as opposed to just signing consent for surgery.
Yeah.
And then, so say a child has had the tonsils and adenoids removed, what would be the reasons they should still go and see an OMT?
I think if there's any mouth breathing before any surgery is done, it needs to be addressed after surgery, because it becomes quite a compensatory pattern. How, our lip muscles, our jaw muscle, like everything becomes so weak. It becomes not just about the enlarged tissues anymore. It becomes about these compensatory patterns that have happened over time. So absolutely, we really want to address, lip seal, and if the tongue posture is still staying low, we want to address tongue strength and mobility. So I think this is really important to address, pre and post surgery. There are some exercises that, I like to recommend that are fun, no pressure, that just encourage lip seal even before surgery is done. So once surgery is done and the obstruction's removed, there's some exercises that the kids are already doing that they don't even know if they're myofunctional therapy tool.
So like what? Because then that's what people always worry about, that they go to see someone, they get more homework and they can't get their child to do the homework, and then they kind of waste the money. So what sort of examples of exercises would you prescribe?
Well, look, I've had to be so creative. I've got a 5-year-old and an 18-month-old, and I've just had to figure out, what's going to work practically, for families and for me. So I recommend rhythms throughout the day. I want to incorporate for families, little exercises that just become a natural part of their day. So, for example, for a 7-year-old boy recently, I've recommended beatboxing. And the way that I presented it to the mother is show your son some beatboxing videos and tell him, I bet you can't do that. Yeah. And leave it. Like, let's see what happens. And for my own children, I actually don't tell them to do anything. In the car, I'm going to be doing my bossy lips, my humming, all my tongue clicks, and I'm not even going to involve them. And it's amazing how curious they become and how they do want to do what I'm doing, particularly for the younger ones. And my 5-year-old starts to do his tongue clicks, and then my 18-month-year-old starts to copy. So, I've even recommended things like playing a wind instrument.
Yeah.
It's great. Wonderful for lip seal. You're not only going to get the myofunctional benefit, but also a benefit to their growth and development of the right and left brain. It's amazing how one simple intervention, if they've got an interest in it, can make such a difference.
So do you mean like a recorder,
trumpet, anything that's brass or wind?
Tin whistle. Tin whistle is an Irish thing. Do you know what a tin whistle is? No.
Like a little
maybe it's an Irish thing. I just want to start to say it. Sorry. And those are great ideas, although no parent really wants their child to learn the recorder, do they?
But once you know the benefit that, for at least 30 minutes a week, they're going to be doing their, recorder lessons at school, hopefully. That's the aim. No extra, after school activities, the ones that you can do in, out of the teacher comes and takes you out of class. And, that's 30 minutes that, they're going to be doing their myofunctional lip seal exercises and breathing exercises at the same time, which is wonderful. Whether or not they practice at home, that's the aim, but at least for 30 minutes a week, they're going to be playing that recorder.
For Rajaka. And I'm a big fan of sleep studies because like anything, it tells you, are you on the right track? Is this a problem or is this not a problem? Same as like getting a building biologist if you think you have mold. Like you just need to define, is it a problem? Is it not a problem? But people always think, oh, my child won't be able to do a sleep study because they don't sleep well. But nobody who goes for a sleep study doesn't have a sleep problem. So the people who do the sleep studies are well trained in dealing with all sorts of kids.
Yeah.
Yeah. It's really,
I think it gives, it gives us really valuable data that, particularly the at-home sleep studies, if some of the nodes fall off, they're not going to give you kind of the really important info about the periodic limb disorder that could be occurring. The ones, in the clinic are the best. And obviously they understand that kids are going to be more restless because it's a new environment, but the key kind of data that you get out is really valuable.
Yeah. Yeah, I agree. So tell me what you see when it comes to like fussy eating and airway issues.
Well, when a child can't breathe comfortably through their nose, eating and breathing and talking is all going to be affected. So it does become quite a big challenge. Often kids will gravitate to the more soft, easier to manage foods as well, particularly if they're having, difficulty chewing really hard and fibrous foods. The taste of food changes, as you know, when you've got a stuffy nose, things just don't taste good. So, that and also the compounded problem of being really tired and at night time, not getting that restorative sleep is all needs to be addressed, or motor function, as well as, giving them a restorative night's sleep.
If she can't breathe well through your nose, it's hard to eat, isn't it?
Hard to enjoy food.
Yeah. Yeah, I haven't really thought about that too much, to be honest. So whenever you do like an assessment on a new patient, how does that go? Obviously, we are primarily a telehealth clinic. So how do you go with making that assessment via telehealth?
So getting some good photos and videos is really important. There are a lot of great tongue exercises that I'll get kids who are, of a certain age to do, to allow me to assess things like, tongue posture, tongue mobility, tongue strength. But ultimately, there will be times when parents do need to see a provider in person, particularly when assessing and possibly releasing a tongue tie. So it's great. We've got a great referral pathways available for kids who, I recommend to see someone in person.
Yeah. And if you listen to some of our other podcasts, we do have quite a few interviews. I think I'm a little bit obsessed. We do have quite a few interviews with airway dentists and speech therapists who are also trained OMTs and all things. So you can listen to all of those and then maybe find someone in your area to help with the other things. So, if parents are listening to this and, panicking quietly and thinking this might be their child, what are the 3 things that they can start with today?
So really simply watching your child sleep, figure out what's happening at night time, and look at their face during the day. Actually see, is their mouth open? Is it closed? How are they eating? Are they chewing on both sides of their mouth, or they're favoring one side? Are they able to swallow comfortably from an open cup? Or are they reliant on their straw water bottle? Notice their behavior and energy throughout the day. Notice if there's any dips, particularly towards the end of the day. And I guess simple things that we can do straight away is, prioritize things like side sleeping as much as we can. Prioritize, looking at their diet. Is dairy a contributor to inflammation and congestion? Have a look at, what they're eating at school. Are they having lots of processed foods? All this can be inflammatory and increase mucus in the body. So addressing allergies, super important as well. Could they have a dust allergy, a mold, a pet dander allergy? The sleep environment is really worth investing in. If they do have an allergy, they spend, up to 12 hours in that room, and that really should be such a really nice, pristine and comfortable environment for them.
Yeah. It's funny, I was bagging out the ENT who, didn't want people to investigate allergies, but also when I was doing my graduate diploma in child health with the University of Western Sydney, the guy who did the ENT lecture in that, he was all about get children onto an anti-inflammatory diet, work out the whole foods, minimize processed food. That should be the first step before surgery is even talked about. So it is so heartwarming to see that the knowledge is there at, I guess, the academic level, but it's not really trickling down to practice as well as it could be. If you could change one thing about how tonsil adenoid issues are managed in children, what would that be?
For me, it's not treating surgery as a finish line, but really addressing the root drivers behind, why these structures enlarge. And often it's an immune and allergy issue. And so, addressing that, but then also having a plan in place after surgery to correct things like an open mouth posture or a low tongue resting posture. As we mentioned, having the surgery restores, cleans out the room. You've got so much more space for oxygen now. However, there's been some compensatory patterns that have occurred due to the obstruction previously that really now need to be addressed. So seeing an OMT is great. So we can restore nasal breathing, retrain, the lip seal and the tongue posture.
Yeah. So I guess basically if your child has an ENT issue, whether you decide to have surgery or don't have surgery, then they should see an OMT before judging them. So it's not instead of, it's as well as. Well, thank you so much, Natalie. It's just wonderful to have the holistic approach, because I know that tonsil and adenoid issues are just massive in our kids today. And absolutely any child before they get a diagnosis of ADHD needs to have a sleep study. And I think that's even written into the guidelines. It's just not really executed that well. So thank you, and thank you for listening.
Thanks for tuning in to Holistic Health for Happy Kids. I hope you found today's episode helpful and inspiring on your journey to raise thriving, healthy little ones. Remember, small, consistent changes can lead to big transformations. If you enjoyed this episode, please subscribe, leave a review, and share it with other parents who might benefit. You can also follow me on Instagram and Facebook at the Paediatric Naturopath for more tips, tools, and inspiration. If you've got a question or a topic you'd love to hear about, please send me a message. I'd love to hear from you. Until next time, take care, and keep supporting your kids in the most natural, nurturing ways possible.